Welcome to the Renew Vitality podcast. My name is Ken Figueira, CEO of Renew Vitality. I'm here with Andy Triggs, Head of Business Development for Renew Vitality, and Medical Director Thierry Jacquemin. Today we're going to focus on the GLP-1 weight loss medications and kind of weight loss overall. I myself lost 50 pounds. Andy, what were you up to?
I lost over 60 pounds of basically just almost exclusively body fat with a GLP-1 combo, sort of starting with semaglutide, transitioning into Tirzepatide, but with a real focus on preserving lean muscle tissue. And I think that's the big difference between all the stuff you hear about GLP-1s with all the side effects, is that if you have a focus and a clinic that can help you to facilitate maintaining lean muscle mass while preserving it, and exclusively trying to aim for reduction in body fat, you can end up in a way better metabolic situation. Dr. Jacquemin, what do you think about GLP-1s?
That's the key, right? The key is you have to take the metabolic advantage that the compound gives you, but you have to do something about it, right? Because if you focus on, there are a lot of people, unfortunately, that have done that, right? If you focus on the scale in that context will also be very rewarding, right? Because you're going to look every week, almost pretty much whatever you're doing. You could sit there and just have a few crackers a day because you're not going to be hungry, and you think that you're doing great, and the number's going down, but you're dropping a bunch of lean muscle mass, right? So the key is, number one, to make sure that you're not going crazy with the dosage. And number two, that you're doing your part. I always tell people that in every context, be an adult, be responsible for what the hell it is that you're doing, and then do it properly. Focus on the quality of your nutrition, focus on your protein intake, focus on your collagen intake, focus on your hydration, all those things. And then that's how you're able to get maximum benefit. Maximum benefit is not, well, I just lost a bunch of weight, whatever ratio of that weight was. No, maximum benefit is drop body fat. Nobody wants to drop lean muscle mass.
Exactly. It's a focus on changing body composition that's the key. And it's like, and preserving lean tissue while you lose body fat almost exclusively is really the goal. It's like, there's nothing worse than a patient losing 40 pounds when half of it's lean muscle, half of it's body fat, and then they come off of the medication and rebound and gain 40 pounds of body fat. Now they're in a way worse metabolic situation than had they never done a GLP-1 in the first place.
By the way, right, like this rebound phenomenon, or what we talked about for many years, is like the yo-yo diet phenomenon. First of all, it's not exclusive to GLP-1 compounds, right? Because yo-yo diets have persisted for years and years, and the reason they keep resurfacing is because they don't work, and then every single time you do it, you're forced to have to go back and redo it. So it's not an exclusive thing to GLP-1. It is exactly as you said, because people are not focusing on lean muscle mass. And then with that, I wanna take the opportunity to mention something that comes up almost on a daily basis, right? Where people will say, well, I have 80 pounds to lose or whatever, but I'm concerned because I don't want to rebound. And then what I tell people is to say, look, well, first of all, the medication is not a vaccine against overeating, right? I mean, if you're doing everything wrong that leads you to this place, to be a little blunt here, and then you fix it with the medication, then you come off, and then you do exactly the same set of wrong things that you were doing before, guess what's going to happen? Back to where you were, right? So you still, as an adult, have to take responsibility for your health, for your eating, for how you manage your life to make sure that doesn't happen. But you basically have to use that as a springboard to maximize the results from a properly structured plan. So it isn't that being on a GLP-1 gives you, carte blanche to just eat whatever it is that you want and drop weight and then come off of it and somehow magically you're going to stay at, 2% body fat, which is what a lot of people believe. No, nothing works like that. Something works while you use it, so long as you do it correctly. What you have to do is you have to use the GLP-1 almost as a biofeedback tool, right? So you teach yourself, with the help of a pharmaceutical compound, you teach yourself how to eat properly, right? This idea of literally of, restructuring your brain and restructuring your pathways neural pathways in terms of how you look at food and what that means to your dopamine spikes and all that. That takes time, right? Like this idea of re-education, that's a thing. To be honest, that's a thing in other countries much more than here. In the United States, that doesn't get talked about enough. But that's the whole point. You have to use the compound in its right setting to teach yourself to do what you should be doing properly in the first.
Well, and it seems like if you can educate a patient to prioritize proteins, teach them more about macros, but also it helps to facilitate things like portion control. And then if those patients can maintain that similar portion control subsequent to taking the GLP-1 medications, they'll be satiated by a comparable amount of food as long as they don't continue to overeat like they did in the past. Usually that weight loss is sustainable.
No question. And I mean, a prime example is what you guys have done, right? You lost a significant amount of weight, but of body fat and no lean muscle mass, right? So it is doable. The problem is that if you don't go at it the right way, like what I was saying a few minutes ago, the problem is the compound allows you to get away with stuff if you don't know what you're doing with it, right? It allows you to get away because what we said, right? Like if you just look at the scale, they go, well, 3 pounds down, 5 pounds down. But if you're not paying attention to what it is that you're doing nutritionally, you're wrecking yourself from a body composition standpoint. And then it's a lot harder now because now why is the yo-yo diet a thing, right? Because if you lose 10 pounds of lean muscle mass in the process of losing 10 pounds of body fat, well, now you're back at your original weight, but your body composition is not the same. So your metabolic charge, your metabolic machinery isn't working as well as it was when you were at that weight with better body composition. So now what do? You say, well, now I got to go on an even harder crash. And then so what happens with that? Well, maybe you drop another couple pounds of body fat, but now you drop even more lean muscle mass. Like, oh, great, I got myself back to my ideal weight. Those are the people that say, well, I don't understand. I don't eat much, and my weight doesn't budge anymore. Because you've done a lot to harm your metabolic machinery.
Well, that's exactly right. They go into a metabolic downward spiral. And the problem is that as you continue to reduce lean muscle mass, you continue to reduce your metabolic rate, and the amount of calories you burn at rest continues to diminish. And it's like that becomes unsustainable. And there's no amount of drug or diet or whatever where you can maintain that body weight. And it becomes, you put yourself in a worse metabolic situation than had you not taken the GLP-1 in the first place. I think one of the things that's also super important that you also recommend to patients is not only the prioritization of protein, helping to educate them about portion control, but also the importance of resistance training to be able to maintain bone density and lean muscle mass while on a GLP-1.
Yeah, a lot of people, the default is always to think, well, I have, a few pounds to lose. I basically just have to not eat and do a bunch of cardio, right? That's still the default. Not that cardio doesn't have its place. And not that counting calories has its, of course, they're all useful things, but absolutely, you want to do something, the best thing you can do to yourself, for yourself, to enhance the efficiency of your metabolic charge is to do resistance training.
Absolutely. And because there is all of the studies associated with GLP-1 drugs talk about a net weight loss. They don't talk about the change in body composition. And when they talk about body fat loss versus lean tissue is not just muscle. It's also a loss of connective tissue and bone density. And there's a lot of things that go along with that. So to be able to mitigate those potential downsides, the prioritization of protein, appropriate supplementation, things like supplementing with creatine, amino acids, especially essential amino acids, and resistance training, those things are all key elements. I mean, there was a study actually recently that came out that compared resistance training with cardio and cardio only, those three separate options to see which one caused the greatest reduction in body fat. And resistance training only was actually the optimal outcome, or the optimal mechanism to reduce body fat, with a combination of cardio and resistance training in a close second, but with cardio in a distant third. So resistance training is really key to being able to preserve that lean tissue and to create a sustainable outcome, which is the goal for your patients really, is to not only lose body fat and reduce weight, but to be able to preserve that and to maintain that positive outcome.
To add on to that real quick, Andy, and I know we've discussed this too, we starting telling our clients now under Dr. J's direction is don't do cardio. Like, do not do cardio. Like, it is you'll lose weight too fast,
Yeah.
even when the dosage is appropriate. Like some people are just losing way too much weight, and like you said, the resistance training is the most important. But like not doing cardio is because they'll just disappear.
Well, cardio is good for your heart. Like cardiovascular fitness is good for you. Like you'll
Well,
live
we told
longer
them to
with
walk.
cardiovascular exercise. Walking is profoundly beneficial. I think that's exactly the point.
Yeah.
Like high intensity cardio, like will burn glycogen first. Like it grabs muscle glucose and you run out of that pretty quickly. But then from there it goes after muscle. So when you walk, the benefits of walking have a profound impact on metabolism, reduction in body fat, changes in lipid profile, all those kinds of things. Like, you know, once a person hits their target weight, they're off the GLP-1, you know, they're no longer in a profound caloric deficit, then getting back to normal cardiovascular activities makes a ton of sense. But it's like when you're in a huge caloric deficit, it's like the preservation of lean muscle tissue becomes a priority to the cardiovascular exercise. And a lot of times these drugs, the goals can be met relatively quickly, and then you can create a sustainable result by, you know, reintroducing, you know, those types of activities subsequent to the weight loss.
And Dr. J, I might be making it too simple when I say don't do cardio, but take it a more medical approach to that. What would be?
Well, I think that it's an important thing that you're bringing up, right? Because the unfortunately, people a lot of times will take comments or advice or statements literal over time, right? So you're not saying don't do it ever again, never walk again to the bathroom, right? Take a Uber to go to the kitchen. No, that's not what you're saying.
At the beginning of the protocol,
Exactly.
especially.
Contextually, in that moment, it probably doesn't suit you to go do a bunch of high intensity cardio, right? Why? Because exactly as you said, once you ramp things up, even if you're keeping the dosage conservative and all this other stuff, you're going to tend to drop fairly quickly. So if on top of that, you're creating all this added caloric deficit, you're going to end up dropping preferentially a bit more lean muscle mass, which is the worst thing to do. So everything in its right place.
And Andy and myself, like, we're busy guys. Our weight loss included like zero cardio.
I was super impressed with the way the GLP-1s worked. Like I had a very positive experience. Like, you know, I took the semaglutide and I ramped the dose up relatively quickly, and I had a majority of the side effects that you can get. Whereas a lot of patients, especially when they titrate more slowly, they'll mitigate a lot of those side effects. But I was super disciplined, you know. And the thing is too, is that when you work with an organization that's not just focused on weight loss, like here at Renew Vitality, we're more of a holistic approach to everything. So when you add in things like testosterone optimization, when you add in things like growth hormone secretagogues, when you include dietary supplements like creatine monohydrate, things like that, all of those help with the preservation, building of lean muscle tissue. And then that coupled with the caloric deficit that a GLP-1 creates, and being disciplined enough to prioritize protein and include adequate resistance training, of which I went to the gym maybe a maximum of 3 days a week to do resistance training, my results were absolutely transformational. It was profound. It's like my own before and after, it still blows me away to see what I was able to accomplish in such a short amount of time. But when you have a holistic approach where you deal with a broad array of things as opposed to just weight loss drugs, there's a synergistic benefit to all of those.
Andy, what was crazy is because we were like the first on the scene. You were doing it, I think, way before too.
I was using it for patients.
A long time. So we started in 2020.
Yeah.
And I was like, and I called him like, did you hear about this? He's like, yeah, I did. I'm like, you got to tell us these things. And we were still first on the scene. I remember, Andy, what was that? You had a great line. He's like, I took 8 shots and now I just giggle when I walk in front of a mirror. Like,
oh, it's unbelievable. It's like, it's laughable. You know, I was wearing a pair of size 40 jeans, and then a week and a half later I was wearing 38s, and then a week and a half later it was 36s. I'm like, I'm going to buy one pair of jeans at a time here. It's like, and now I got to the point where I'm like, you know, I weigh 210 pounds. I could fit in a size 30 waist. It's like, it's just, the proportions are just laughable. It's like the medication is phenomenal, but the results are sustainable. And the cool thing is when you work with the right organization that has the right approach, when you have a holistic approach to weight loss, which is nutrition, exercise, you know, pharmaceutical solutions and nutraceutical solutions, and they're all applied appropriately, you can not only create profound results, but you create sustainable results. And I think that's what's clinically appropriate. And that's what a patient's really looking for, is not just to lose weight rapidly, but to have a profound change in body composition that has a wildly beneficial metabolic outcome that's sustainable in perpetuity. That's the optimal outcome.
And that's what we're seeing in the studies, right? Like there seems to for sure be at least a suggestion that there may be a survival benefit or a longevity benefit. Whether it's related exactly to the compound or just the fact that people are at their ideal weight is questionable. But the bottom line is it's the best method to get to that ideal weight and then have it be a sustainable thing, right? No question that your lipid profile gets better, your inflammatory markers get better. There seems to be, again, in ways that haven't really truly been elucidated yet, but there seem to be some anti-inflammatory properties from some of the compounds. I certainly have some patients that have neuroinflammatory conditions that are poorly described and so on, that for one reason or another are doing better on GLP-1 compounds. So it's I think that there is a lot still that is on the table as far as the true cluster of benefits going forward. And then, people bring that up, the fact that, oh, well, I heard it causes this or it causes nausea or there's side effects. At the end of the day, anything that is pharmaceutical compound can potentially cause some untoward side effect, right?
Well, there's no free lunch.
There's no free lunch.
sure.
Exactly that. But then, back to what we've mentioned for some other therapies, the better question is, well, where are you without it, right? So just recently I had this discussion with somebody who said, it wasn't even a patient, it was a colleague actually. In the middle of the discussion, said, oh, I heard that you use it for some patients for weight loss, but it could cause this and this. Like, well, walking around with 50 pounds extra weight also causes this, and a lot more other issues, right?
Well, it's way worse to be fat than it is to have acid reflux.
No question.
You know what I mean? Like there's
No
a lot,
question.
there's the downside of being 50 or 80 pounds
Right.
overweight. But you talked about mortality. I think there's a huge impact. Like losing the weight has such a profound benefit when it comes to longevity that it's like, minimal side effects relative to the potential increase in lifespan and mitigating all these other comorbidities like lipid profile changes, blood pressure changes in blood glucose. Like there's a lot of things that happen when you take the GLP-1 drugs that help to mitigate all kinds of potential future negative outcomes and to deal with all those different issues. Being fat is way worse
I
than
agree.
the side effects of GLP-1.
I agree.
Now, listen, I was the poster child for the yo-yo. Like, I had love handles playing college soccer. Like, I could not lose weight.
Yeah.
I don't know what mental disorder I had, but every dinner I would eat all the bread, all the appetizer, and I don't leave food on the plate.
Right.
Like, eat all the dinner, eat all the dessert. It was a problem. It was one of the things I had no self-control over. So up and down, I was skinny a couple times throughout my life. But since the GLP-1s, it's a wrap.
But it's a profound change in your body.
It changes the way you
composition.
look at food.
Right.
It's just not as important anymore. Where if anything happened, food was always the answer.
Yeah.
Well, I think one thing
Right.
too, though, is
If you're happy, you eat. If you're sad, you eat.
Absolutely.
If you hit a goal, you eat. If you miss a goal, you eat.
Yeah.
the neat thing is that the GLP-1 receptor, like I don't think there's ever been more research into it than there is now. And we're starting to find that the GLP-1 receptor agonist has an effect on addiction. Like you start to see people who alcohol cessation, smoking cessation, cocaine cessation. There's a lot of things that it reduces your appetite for a lot of these different, these different compounds. Like I know that I wouldn't drink very regularly, but when I did start taking semaglutide and subsequently Tirzepatide, I had no appetite for alcohol, none whatsoever. And we've had countless patients who have said, I can't smoke. I just can't stomach it anymore.
Yeah.
And I quit smoking cigarettes. Like there's a whole litany of other different disease states that we've had patients who come to us on, and they've started a GLP-1 and seen huge improvements. Like we've had patients who've had Crohn's, patients who've had ulcerative colitis, who've seen huge improvements or even completely eliminated
Absolutely.
any negative issues. Some of the autoimmune diseases, the GLP-1s seem to have a positive impact on. it's really been substantial. So I don't think we know the totality of the benefits of these GLP-1 drugs yet.
No, I agree. Because at the end of the day, the mechanism, right? If you look at the mechanism of the GLP-1 compound, or in a case of tirzepatide, where you have a GIP component, also there's not just the satiety component to it, but also a little bit of basically what amounts to some metabolic restructuring, right? That has applicability for a lot of other factors, a lot of which we are barely starting to see, like I mentioned, we're barely starting to scratch the surface and see some underlying benefits, even though the mechanisms may not be fully clear. And I think that obviously with any compound, the more data you have based on how many patients and how many years on it, the more we're going to start seeing a pattern, the more we're going to start seeing off-label uses of it for the same thing. But I've seen it in my clinical practice already. We've seen it with Vitality patients. Absolutely. That's a thing. That's a very, very real thing. Like, people go on it and they have this cluster of benefits. They come off of it. It comes back. They go back on it.
So, and that's a great point, I think, as well, is that there's been a lot of discussion now that these drugs have been around long enough where there's patients who are either going into a maintenance dose, or the new key term that a lot of people are using is microdosing.
Yeah.
What do you think about maintenance dosing or microdosing of GLP-1s?
I think it depends a lot on what you're managing. If you don't need to be on it, and your weight is great and your body composition is great and your health is perfect, there isn't anything additional to manage that may give you some extraneous benefit from it, then you probably don't need to be on it. If you're a long-term, let's say type 2 diabetic, obviously that's a different discussion, but clearly that's a discussion. If we're, sort of dabbling into the off-label parameters, right, of autoimmunity and so on and so forth, I think more and more we're going to start seeing some microdosing protocols for the length of the lifespan.
So you're waiting on more data to come out before you put the
I think it's just a
stamp on
case by
ongoing.
Yeah, I mean, I think it's a case by case. I definitely have some patients who realistically, at least from the standpoint of weight management and so on, may not do so well if they come off. We have seen that.
Here,
Right. And then it may just be a situation of, like, benefit versus risk of coming off, and in which case the benefit, like in a case like yours, for example, the benefit far outweighs the possibility of coming off.
50 pounds heavier.
Yeah, exactly. Right. Like there's a absolute metabolic and lifespan cost that you pay from carrying that extra weight for your lifespan. Right. So no question. On the other hand, somebody that maybe, uses it to lose a smaller amount perhaps, or maybe even the same amount, but doesn't need it. Say, well, like like I've restructured things and I'm good. And maybe they don't necessarily need it. I think it has to be individualized. So would I
Okay.
recommend an ongoing protocol for everybody across the board? No, because some people may not require it.
But see, then again, that's why it's so important not to work with just someone who's not a specialist. Like, when you come to an organization like Renew Vitality and work with someone like Dr. Jacquemin, you get the benefit of the individualized attention, the individualized treatment. And your emphasis is absolutely right, is that it's a patient by patient basis. Like, some patients may benefit. I've taken Tirzepatide in a very low dosage, and I've continued to see very small incremental improvements and reductions in body fat to the point where I can see where I'm at, like, physiologically, and it's literally laughable how profound the effect has been.
Yeah.
Where I see a very small, on a very low dose, combined with testosterone and a secretagogue, but a very incremental continued decrease in body fat to the point where it's like I am in the best, at least, the best physical condition, in my entire life at 45 years old, which is just profound. One thing I think too that's helpful is a lot of people have questions about what a GLP-1 is. Like, and really the core components I think that sometimes are important to point out is it has kind of it impacts two different hormones in the body. And can you speak a little bit to the effects on ghrelin and the effects on leptin as to kind of how GLP-1s actually work?
GLP-1 is essentially a satiety hormone, right? So if you think about it, it's more basic. It's a hormone that forges a connection between brain and your small intestine. So it basically signals to yourself that you're full, right? And so the idea as we go forward and people are on it for some degree of an ongoing basis is basically that there is a, like we hinted at earlier, there's a biofeedback component to it, right? You literally are reteaching your body, because what's happening and alarming rates, in large part because of artificial flavors and processed foods and everything else, is that our very basic, primitive, but very helpful satiety mechanisms are being just shot to death, right? They're just being annihilated by overwhelming flavor patterns and everything else, and we're sort of losing that mechanism more and more. And so that's very much a dynamic process that can go in a positive direction or in a negative direction. And so really the main reason why GLP-1 compounds have worked so well is specifically because of that metabolic restructuring, because you literally are reteaching yourself to feed yourself properly. You're teaching yourself how to respond to food, how our ancestors would have responded to food. So that's really the core of the GLP-1 component.
So when the drug basically, 'cause I know there's a lot of people who like a technical answer in there. There's plenty of people who are happy with the fact I take my shot, I lose my weight, I'm super happy. But it's like, but the core, what you're talking about specifically is basically like as the GLP-1 reduces ghrelin, and you see that slowed gastric emptying, you feel fuller longer. And when you talk about satiety, it's like that's where you get the benefit of like you feel full. So when the GLP-1 reduces ghrelin, it causes a slower gastric emptying, so you feel fuller longer, you stay fuller longer. And then subsequently, when it increases the production of leptin, that signals the brain to say, hey, we're satisfied. We have adequate, we've been satisfied, nutritionally, or at least when it comes to being fed. Those two things happening simultaneously is what helps to trick the body into the feeling of satiety, and that you don't then continue to feel hungry. So that's like basically the mechanism of the GLP-1.
So with the Tirzepatide, it has the additional GIP. And what is that?
The GIP is another hormone-like substance, the whole point being that you get not only the satiety component to it, so it's a more complete compound than the compounds that have come before. Not to say that semaglutide and the other compounds don't work. They certainly work, and we see plenty of amazing benefit from it. The GIP component sort of helps to basically reactivate or restructure your metabolic machinery. So it's not a stimulant. People sometimes misconstrue that. I think it's some kind of a stimulant, like the old-fashioned stimulants that we use, where it has nothing to do with that. But at the metabolic level, there is some activation, which is why you tend to get two core benefits once you combine those two compounds. You have, number one, you have the mitigation of side effects, right? I think pretty much everybody can attest to the fact, everybody who has sort of been on both, except for some rare exceptions, people tend to get less, at least gastrointestinal side effects from the combination. That's number one. And then number two, from the standpoint of sustainability, dose per dose, once you sort of max your GLP-1 dosage, if you're using a pure GLP-1 compound, there's usually plenty of added benefit from using combination therapy.
No, and I think there was just a study released recently that had a head-to-head comparison, which in FDA approval studies and things like that, it usually shows the drug versus placebo, and which is not super helpful when you're looking to find out what drug is optimal. And although semaglutide has changed a ton of lives, the Tirzepatide, there was a study just recently where they put them head-to-head compared against each other, and the dual component GLP-1 GIP turned out to be over the long term, much more effective at producing weight loss. But again, all these studies, they focus on weight loss and not on changes in body composition, not on lean muscle mass. And that's where an organization such as ours and a practitioner such as yourself can bring a lot more value, because it's not just take this drug, relatively unsupervised through whichever physician wrote it for you, but like someone needs to give you kind of a instruction manual along with it so that you incorporate, all these things like nutrition, macronutrient ratios, with especially the prioritization of protein, resistance training, and potentially other pharmaceuticals and nutraceuticals as well. Like testosterone is a wildly effective compound at helping to preserve lean muscle mass, or things like creatine monohydrate or essential aminos or things like that that'll help to preserve lean tissue. So it's like, if you're going to use a GLP-1 and you want to have fat loss versus weight loss and end up in a better metabolic situation that has a sustainable result, then you want to work with an organization like Renew Vitality and Dr. Jacquemin.
Most importantly, I think, for the GLP-1s. Would you say that?
Most important as far
Like
as
getting the help, like more individual attention.
Oh, no question.
Okay.
No question. I was sitting down very recently trying to do this math in my head. I didn't get a good calculation, but for sure, qualitatively speaking, at least, I was thinking, if I could sit down, both as it applies to hormones, as it applies to GLP-1 treatment and so on, if I could sit down and just make these very hard, rigid protocols, I could probably work 2 hours a day. The problem is I'd be doing a really bad job for like 95% of people. Because to be fair, there are people who are right in the box, right? Protocol works exactly as it is, nothing to worry about, nothing to do. But that's unfortunately a really small minority. Physiology is common for all of us, sure, but the individualities make a huge difference, right?
No,
so
lifestyle.
The only way that you do it is if it's either individualized or it's nothing at all.
I think that's really what differentiates organizations like ours from all of these different clinics that are out there that sell you a monthly payment program or some other kind of thing where it's like, oh, well, your first month is this dose and then your next month might be this dose or whatever. Or it's like there's a monthly payment associated with different. It just doesn't make sense because what you end up with is exactly that. You get a cookie cutter protocol with maybe one practitioner overseeing an enormous amount of patients and everybody just places their order online and you just kind of get whatever you get. And there isn't that individualized attention. There's not that holistic approach. There's not a comprehensive solution. And that's where people end up, just buying drugs and seesawing back and forth, as opposed to we want to produce, a profound result that is a change in body composition that's sustainable. And it's a bad business model if you produce sustainable results and patients don't need you anymore. But it's the best kind of medicine to practice. So
no question.
That's certainly what differentiates Renew Vitality from the rest of the competition.
At dinners, I have to tip more now because we eat so little.
You feel bad for them?
Yeah, I mean,
well, I think you said you order
expensive.
appetizers, but no, you're right. It's the satiety issue. It's you're literally you're full off eating, and that's why you have to focus on protein. Like you have to eat the protein first because you put down an 8-ounce fillet and you're stuffed.
Yeah, that's important too. That they have to prioritize their protein when they're on the GLP-1s.
But no, it's just like anything else. Like when you teach people to eat properly, devoid of a GLP-1 drug, it's like you eat your protein first. It's going to give you the benefit of appetite suppression. You eat slowly. People who eat quickly are the ones who end up overweight. So it's like all the things, you could teach a lot of things, and we try to educate patients with all that so that when they do come off the medication, their results are sustainable. But it's prioritizing protein, it's portion control, it's eating slowly. It's all of those things. It's hydrating appropriately. And one of the benefits too, especially, is the reduced alcohol consumption while they're on. And usually that perpetuates afterwards. So that's beneficial for a whole litany of reasons.
Yeah, for sure.
The two most profound results that I've received, and I think this goes for most people, is testosterone and GLP-1s.
Oh, for sure. And they go together like peanut butter and jelly.
Right.
Like
maintain lean muscle.
Yeah.
With the testosterone. Stay lean with the GLP-1s.
Now, one of the side effects of the testosterone with the GLP-1s that you talked about trying to avoid earlier was to mitigate cardio. And the testosterone is not so great when you do increase the sex drive. So there is some increased cardio, but, not every program is perfect.
It's the good cardio.
Thank you for joining us today at the Renew Vitality podcast. We appreciate the opportunity to provide insights and information on new and cutting-edge pharmaceutical and nutraceutical opportunities for patients to be able to optimize their health. And when you're ready to get started on a program, go to vitalityhrt.com, fill out a contact form, and one of our patient coordinators will get you started today.